Hey, good evening, my friend. Welcome back. I'm so glad you're here tonight because what I'm about to share with you could genuinely change the way you feel when you wake up tomorrow morning. We're talking about neck pain, that stiffness, that tightness, those headaches that seem to show up out of nowhere. And I'm going to give you a simple, natural routine you can do right before bed tonight that will start turning things around. No pills, no injections, no surgery. Just your own body doing what it was designed to do, heal itself. So let's get right into it. Now, neck pain is one of the most common complaints I see in my practice. That deep ache at the base of the skull, that stiffness when you try to turn your head, those tension headaches that creep up over the top of your head like a vice grip around your temples. If any of that sounds familiar, and I know it does for so many of you, then stay with me. Here's what's happening inside your neck. Your cervical spine, the 7 bones in your neck. They stack on top of each other like a perfectly engineered column. Between each bone, there are discs, little shock absorbers. Around them, muscles, tendons, and ligaments hold everything together. When that system is in balance, you feel great. But when something throws it off, those muscles tighten, those joints get restricted, those nerves get irritated. And that's when the pain and stiffness begin. So what's throwing it off? The number one cause today, by a landslide, is forward head posture. When you're on your phone, at a computer, hunched over a desk, your head drifts forward. And here's what most people don't realize. For every inch your head moves forward, the effective weight on your neck doubles. Your head weighs about 10 to 12 pounds, perfectly balanced. Lean it forward just 2 inches, which most of us do all day, and now your neck is working as if it weighs 25 pounds. All day, every single day. Is it any wonder your neck hurts? And those muscles at the base of your skull, the suboccipital muscles, when they're constantly overworked, they compress the nerves and blood vessels right there. And that is one of the most common triggers of tension headaches. The headache isn't coming from your head, it's coming from your neck. The second big cause is how you sleep. Sleeping on your stomach is one of the worst things you can do for your cervical spine. You're rotating your head to one side for hours under compression. And if your pillow is too high or too low, that matters enormously too. The third cause is stress. The trapezius muscle, running from your skull down to your mid-back, is like a stress sponge. By the end of the day, for most people, it is completely saturated. Now let me show you exactly what to do about it, starting tonight. The first technique is the chin tuck. Sit up tall. Gently pull your chin straight back. Not down, not up, straight back, like you're making a double chin. Hold 5 seconds, relax. Do that 10 times. What you're doing is retraining the deep neck muscles, decompressing the joints at the back of your neck, and actively reversing that forward head posture. 10 repetitions, 2 to 3 times a day, especially before bed. Try this for the next 7 to 14 days and watch what happens. The second technique is the suboccipital release. Take 2 tennis balls, drop them in a sock, and tie the end. Lie on your back and place those balls right at the base of your skull, one on each side of the spine. Just rest the weight of your head on them. Breathe deeply, in through your nose, out through your mouth, and let gravity do the work for 2 to 3 minutes. This releases the tension at the base of the skull, decompresses the upper cervical spine, and improves blood flow. A lot of people feel their headache starting to melt away within minutes. It is that powerful. The third thing, a neck side stretch with deep breathing. Slowly tilt your head toward your right shoulder. Take a slow, deep breath in, and as you breathe out, let the weight of your head gently deepen that stretch just a little more. Hold 30 seconds. Switch sides. Do each side twice. The deep breathing activates your rest and digest system and helps those muscles actually let go instead of fighting the stretch. Now here's something most people overlook completely: hydration. Your cervical discs are about 70 to 80% water. During the day, they get compressed and lose fluid. At night, they rehydrate. But if you're chronically dehydrated, those discs can't fully recover. So every evening before bed, drink a good glass of water. Throughout the day, aim for half your body weight in ounces. That is foundational for your spine. I also want you to think about magnesium. This mineral helps muscles relax, regulates nerve function, and supports deep sleep. Most people are deficient in it. Magnesium glycinate before bed is my top recommendation. Highly absorbable, gentle on the stomach. You can also get it from almonds, pumpkin seeds, avocado, and dark leafy greens. One more thing, your pillow setup. Back sleepers, use a cervical contour pillow that supports the natural curve of your neck. Side sleepers, your pillow needs to be thick enough to keep your head level with your spine in a perfectly neutral, straight line. Take a moment tonight to assess this. It makes a bigger difference than most people ever realize. And finally, put the phone down at least 30 minutes before bed. If you're lying there scrolling with your neck bent forward, you are undoing everything I just taught you. Do your neck routine instead. Do some slow, deep belly breathing. Let your nervous system calm down and let your spine decompress. You will sleep better and wake up feeling genuinely restored. So here's your simple game plan for tonight. Do your chin tucks, 10 reps, 5 seconds each. Use the tennis ball release at the base of your skull for 2 to 3 minutes. Do your neck side stretches with deep breathing. Check your pillow position. Drink water before bed. Consider magnesium. And put the phone away and give your body the peace it needs to heal. My friend, try this consistently for the next 7 to 14 days. Not once, consistently. Because real healing takes a little time and a little commitment. But I promise you, if you stick with this, you will feel the difference. I have seen this work for so many people, and I know it can work for you too. Your body was built to recover, to restore, to heal, when you give it the right conditions. So work with it, not against it. If this helped you tonight, drop a comment below and tell me how it goes. Tell me which technique gave you the most relief, because your results inspire others, and that is what this is all about. God bless you. Stay well. I'll see you in the next one.